And this is really where it opened my eyes to these patients need to be coached, because when you go from a second generation HRT system to a more advanced protocol designed for full restoration, it really does change a brain of a woman and her body, where the brain and body are trying to get as healthy as possible. And so it goes through this transitional process of getting healthier and better, but it can be an up and down experience where a patient can experience positive clinical indicators like such as breast tenderness or a headache or bloating. And then these are temporary. And then they'll, at the same time, they'll feel on top of the world and they'll feel good. And they have this organic energy and a libido and stamina and brain fog is lifted. So a patient can go through both of these things. And we learn that a woman really needs to understand how the hormones are taken. They need somebody to talk to about anything that they're experiencing with this to help calm them down and to let them know that, yes, you're on the right track. Continue what you're doing. I know your boobs hurt now, but they won't next week. And this is why they won't hurt next week. And so they really need to be walked through this protocol. They can't be left alone with it because it is a sophisticated protocol. Hello, everyone. Welcome to the MeNoPause Moxie Podcast, where we strategically challenge the status quo on perimenopause, menopause, and female hormone balancing. I'm your host, Marie Hoäg, and with me here today is Maggie Kuhn, my producer and co-host. Welcome to the show. Today, we're going to talk about how I've gone from being a hormone patient to a clinical hormone coach and my 2-decade career in female hormone medicine. Hey, Maggie, how are you?
Hey, Marie, I'm doing well. We've got another great episode coming up. And so, in our last episode, we were talking about your personal journey to HRT, which included, really difficult periods through starting at age 12 onwards, moving into mental health issues, and things had gotten really pretty dire for you, as you shared. And then you got to this point in your early 30s where you met a doctor who was the first one to raise that these issues might be hormonal, and you started working with him as a patient. You became his patient, but you also started working in his practice, working with women who were receiving hormone replacement therapy through him. And you got a real ringside seat to the trends of what was going on, what was working, what wasn't working. And this led to you having, I think, a body of research that is probably unparalleled with anyone else. You have clinical research on how hormone replacement therapy works, why it stops working, and what needs to change for women. And so today we're going to be talking about your professional career trajectory and how you went from starting in that hormone clinic. What were some of the things you were seeing, and that led you to eventually establishing Panacea Sciences and really the Panacea protocol. So let's jump into that. Take us back to, I think it's 2003, and you're a patient, and you're also working or starting to work in the clinic. And tell us about your job and what you were seeing.
When I first started working in this particular with this doctor, he asked me to do some consulting for him for his practice. And this is where I got a glimpse of what was going on in the practice. I knew that I was having some success with the diet and lifestyle changes that he had me doing, which helped my estrogen levels at that time. But I hadn't been on hormone therapy yet at this point. So when I started working in the clinic, what I do within the first 90 days is really assess the practice. What are the protocols like in the practice, the administrative protocols, the clinical protocols? What are the results patients are getting? What's the conversations the patients are having? Um, and assess the practice on what needs to be done. But something in this practice I noticed that I had never seen in any other practice was that when patients came back for their follow-up visits, they were better than they were than the last time they came in. And I'd never seen this before. And so I started asking patients, why do you think you're feeling better? And they said, well, I just did what the doctor recommended. And I was actually going through that myself, but I didn't know that this was actually a thing, that patients got better. And it intrigued me and wanted me to work with this physician. He was also getting ready to start a fellowship at the American Academy of Anti-Aging Medicine when they were coupled together with the Institute for Functional Medicine. And so I asked him, I said, listen, let me work with you full time. Let me help you build this business, because for me, it's better for me as a consultant. If you have a niche, I can build around that niche. And he says, I'll do that if you go through this fellowship with me. I'll pay your tuition. And then that was really such a privilege of what we were learning then. And then getting a glimpse of what was going on with the patients. But also around this time, this was actually the year that Suzanne Summers came out with her book, The Sexy Years.
I remember that book. I actually read it as well. And that was a big eye opener for me, as I'm sure it was for you.
Well, yeah, it's because of Suzanne Summers that hormone therapy is a household name. She really is a pioneer in this industry. She brought talking about hormones to the forefront right up a year after the Women's Health Initiative study came out that scared everybody off of estrogen. So, though there were people that were afraid of estrogen because of the WHI study, there was also a group of women who were really relating to Suzanne Summers and what she was talking about. And they wanted to do what she was doing, and they didn't have that fear of estrogen. And this is what we were actually learning in our education, was this type of hormone therapy that she was talking about, the bioidentical hormone therapy, the low dose HRT systems. But also we get into the 4 generations of HRT in another podcast, but this is when they were doing the low dose type of protocols to manage the symptoms of hormone deficiency. So we were learning a lot, and we were watching patients get these great results that we were reading about from Suzanne Summers and all the positive impact that we were getting from patients. So we just were so excited at this time because it was a big movement, and mostly because of what we were seeing clinically, the response.
Mm-hmm. And you were tracking women's clinical indicators and their blood serum results, and so you were starting to see correlations of their clinical indicator symptoms perhaps going down as their levels were going up.
I didn't start the tracking of the clinical indicators until a little later on a different protocol, but I didn't start hormone therapy quite yet, because during this time in the early 2000s, we didn't really start hormone therapy on women until they stopped having a period. And but we didn't really want to leave perimenopausal women in the lurch. Well, actually, we didn't even talk about perimenopause so much. It really wasn't a thing so much about 20 years ago. But we knew that women heading towards menopause were suffering. So we would put them on what I was doing at that time, going on a very specific diet and lifestyle to increase ovarian function. So there's a protocol that we'd put patients on that we can tell if their ovaries are working or not. And we would test blood levels and then how a patient feels. And then once it's been deemed that the ovaries are no longer able to produce enough estrogen and progesterone to maintain a healthy cycle, then the protocol at that time was just sell a bunch of supplements or medications until they stop having a period. But these women, these perimenopausal women, kept asking, can't you just give me some hormones? What we found was these low dose therapies stopped working in about 6 to 9 months. And so we were excited to start the hormone therapy. Patients were feeling good, but then we saw this trend of, well, women are acting like they're not on hormones at all. They're complaining about the same things they did before they started hormone therapy. What's up? So when we would go back to the conferences as we were continuing our training, we would ask our mentors, and what do we do when we've maxed out on the dose of these low dose therapies? And they said, well, you're just going to have to use your best judgment. And so there was no real education or training beyond this. And so what happens here is there was this standstill with what are we going to do? Well, we're telling patients you're on hormones. We can't give you any more because this is all we know. But here, buy these supplements and take these medications to manage the symptoms. And it just made us curious on why were we able to get rid of the symptoms when the patient started hormone therapy, and when did it fail? Why is this now a problem, and why did it stop? And this is also about the time where Suzanne Somers actually changed her protocol. She went from this low dose protocol to what we talk about in another podcast is a third generation HRT system, the Wiley protocol. So now our phones are ringing asking us if we do the Wiley protocol. And we didn't know what that was, which made us curious because we thought we had taken every class offered in HRT. So what is this? And what's this protocol about? So we contacted Wiley and we educated ourselves about it. And we got clinically trained to prescribe it and to manage patients on this particular protocol. And so Suzanne Somers took us from a second generation HRT system to a third generation HRT system. And what was interesting about this HRT system that's vastly different than a second generation HRT system of the low dose hormones is women are getting higher levels of estrogen. And also the Wiley protocol is a physiologic protocol designed to restore and maintain a healthy menstrual cycle. You don't get that with first and second generation HRT systems because the doses are too low and they peter out over time because the brains and bodies of women require more estrogen than these lower dose protocols yield. But when you give women the hormones that they need at the levels that actually calm their brain and make them feel good and regulates the processes of the body, you wake up the uterus. You're actually sending signals to the brain that a woman's in her reproductive prime. So the uterus wakes up and then a healthy menstrual cycle is supposed to take effect. And so this was fascinating. Now, this is when I first started on the low dose around the time when I realized that I can't eat my way into a healthy menstrual cycle. And there's nothing I can do to regulate the ovaries that were breaking down in me. And so we decided really once we've determined that a woman's ovaries are no longer producing adequate levels of estrogen and progesterone, whether she's in menopause or not, that we're going to give women hormones. And so I think we were one of the first clinics that offered HRT for women before menopause, because now we can regulate the menstrual cycle. And so this now we were getting into a deep dive of this protocol, and this is the one that impacted my life the most. Have you ever been on have you ever been on the Wiley protocol?
I've not been on the Wiley protocol. I did read about it, and was super intrigued. It opened my mind, but I couldn't find anybody who practiced it. So, and I didn't understand, to be honest, I didn't understand the point about
why do you want a period?
Exactly.
Oh my gosh. And now, I mean, the period is just non-incidental. The period is just really the body's outwardly way of telling a woman that all things are working well in her brain and body. And that's just a mere, non-incidental thing, really.
I remember she said something in the book to the effect of, I'm willing to have a period once a month in order to feel great all the time, have a fabulous intimate relationship with my husband, and feel sexy. That was her point. These can be the sexy years.
And the patients that when we started learning about this protocol and we started transferring patients onto this protocol, and this is really where it opened my eyes to these patients need to be coached, because when you go from a second generation HRT system to a more advanced protocol designed for full restoration, it really does change a brain of a woman and her body, where the brain and body are trying to get as healthy as possible. And so it goes through this transitional process of getting healthier and better. but it can be an up and down experience where a patient can experience positive clinical indicators like such as breast tenderness or a headache or bloating. And then these are temporary. And then they'll, at the same time, they'll feel on top of the world, and they'll feel good, and they have this organic energy and a libido and stamina, and brain fog is lifted. So a patient can go through both of these things. And we learn that a woman really needs to understand how the hormones are taken. They need somebody to talk to about anything that they're experiencing with this, to help calm them down and to let them know that, yes, you're on the right track. Continue what you're doing. I know your boobs hurt now, but they won't next week. And this is why they won't hurt next week. And so they really need to be walked through this protocol. They can't be left alone with it, because it is a sophisticated protocol. But once they have it down, it's a pretty good system. Except the Wiley protocol, we found a lot of clinical flaws that we really don't really need to even dance around any longer because of more advanced protocols. But this particular protocol was life-changing for me, because it completely got rid of my depression. And I talked about my depression in episode 1. Not only did it get rid of my depression and anxiety, I actually felt for the first time in my life what happiness felt like genuinely happy from at the core for no reason every day. And that was quite an experience. That was a big turning point in my life.
And you
And
having that experience let you know that it was possible, and that if it was possible for you, it was possible for others. And you just happen to also be placed in this clinic that's providing hormone therapy. So you're uniquely situated to take your great experience and translate it to other women. And so tell us more about what started to happen for you from that standpoint, and that you started to notice some patterns.
well, because I coach patients every time they come in for their visit, I check them in, take their vitals, and talk to them about how they're feeling, and take a look at their lab work. And I would review their lab work with them. And so this is when I started to realize, when women would say certain things of, I feel this way, or the brain fog is lifted, or the tinnitus, I no longer have tinnitus. I noticed that when women said these things, I'd have their lab sitting in front of me. This is before electronic health records. I'd have their lab sitting in front of me, and I just happened to, because this is what I did all day long, patient after patient, they'd say, oh my gosh, I cannot believe my libido, and I have all this energy. And I look down, I'd read their labs, and I can see their estrogen is in a particular range. And that the clinical indicators they were given me, I noticed that they were different levels. When women said, oh, my boobs hurt, or this is happening, I noticed they were still in the double digits. And
Double
so,
digits of what?
of estrogen,
Okay.
of, looking
Meaning
at
their
their lab
blood
work.
level was in the double digits on their test.
Yes. Double digits PG per ml on the standard American reference ranges, the ranges for estrogen. And so I started marking down, and I started tracking the top 50. And we talk about this in the clinical indicator podcast, but I started tracking the top 50 things that women talked about the most. And there's more than that, but 50 was, I just took the top 50 and then started measuring those against blood work. And this is how we realized that how women felt worked in real time of our estrogen levels. So when a patient would crash, like if a patient was hormonally balanced on a certain protocol, and then they're calling me 2 weeks later, sobbing and telling me how horrible they feel, well, I would have them go to the lab and get their blood drawn so I can see and what their estrogen level was, because I suspected that this was a real time with estrogen level situation. And that's what ended up happening. And so we would see that. And then the question is, how did you go from 2 weeks ago, your labs were here and you were feeling good, and now you feel horrible, but now you're tanked on your estrogen. So then I started to ask, okay, now tell me how you're taking your hormones. And this is how we learn how patients take the hormones influence the level. So this is really, over the past couple of decades, there's just been this evolution of HRT and learning about it, because they only taught us at A4M just these low dose keep hormones low with the lowest dose possible for the shortest amount of time, but nobody's ever really given us what that timeline is and how high we can go. But they usually say when the patient starts spotting them, back off. But as you know, we all know who've been on hormone therapy, this doesn't work for very long.
Well, I mean, there's, numerous forums these days, and now, back in the day when you were talking about this, there wasn't that. So thank goodness they had you to go to. But frankly, these forums, I think, get so confusing because, and I often see, I was feeling great, this was working, and now it's not. And, they're getting hit with all kinds of advice from just other lay people. And it can get really confusing for the patient. And so it is
So
true that
much.
hormones often stop working, but you started tracking that and figured out why.
And
And
really,
they also need a coach who knows what they're talking about and doing to walk them through this.
yeah, and to your point about these social media groups, I mean, you can't just change a hormone and think that's just going to do the trick or be on the same protocol as another woman and yield the same blood level results. I mean, that's one thing we learn too, and they don't tell us that. I mean, that's something we had to figure out on our own. We can give the same HRT protocol to 5 different women and get 5 different clinical results. Then we had to figure out why. Why is this happening? And because I was very curious. And so I started tracking these too. And this is where we also learned that what women ate and how women live their lives influenced the estrogen, the hormones they were taking, not just estrogen, but progesterone and other hormones that were prescribed. So it wasn't just about hormone therapy. And uh, and women in these groups, when they say, "Oh, we'll take this worked for me," or another one I like is if a woman takes a 2 milligram estrogen, these aren't real dosages, a 2 milligram oral estrogen, and she thinks that she can cross that with taking 2 milligrams of an injectable estrogen, that it's going to be the same, and it is not at all. It is, they're not, these protocols are not interchangeable. And it really is an effort by a trained physician, because there's a technique and a process to get to the hormone sweet spot, because there is a place of optimal and true hormonal balance that a lot of women don't achieve because they're so busy making all these adjustments that they're not even giving the hormones a chance to work.
Let's talk a little bit about this concept of the hormone sweet spot and how you came to that idea and what it is. What do you mean by that?
Well, one of the questions that we were asking clinically, among the physicians and myself, and you know and what we were learning was, at what point are the patient's hormones balanced? Because if we know that low dose stops working and the patient still has symptoms, even on the highest, lowest dose possible, how do we know when their hormones are balanced? And they don't teach this anywhere. And how does the doctor determine that? And, and this is what I wanted to find out for myself. And also other women wanted to know too, because patients kept asking for more estrogen. But then I realized, especially with the Wiley protocol, that there really was a place where women stopped asking for more. And so we measure blood work. So what was this range where women stopped asking for more? And then there was a group of women too that they felt good where they were. They weren't asking for more, but they were curious, wondering how they would feel if they had more. And I was in this group because I kept titrating my dose up and adapting to it. And then there was a place where I felt like I couldn't imagine, I could not imagine feeling any better. And I still don't. I can't imagine feeling any better than I do in my life. I mean, just mentally and physically. And, I mean, honestly, it's such a night and day change. But I wanted to know, and I talked to the doctors I was working with about this. It's like, I know that I don't feel like I need more estrogen, but how do we know if one more tweak won't make me feel even better? Because every visit I kept saying, well, I feel better than I ever have, but I was still on low dose because I never had any estrogen at all. So any tweak, even a low dose tweak, I felt better.
Mm.
And then there was that point where that tweak, that one tweak made me feel not so good, as if I didn't have hormones at all. It was almost acting like having a paradoxical effect. And then the other women that were in the same boat with me who gave them, the doctor made that tweaking adjustment, we realized that, well, gosh, maybe that's too much estrogen.
So there
So,
is such a thing as too much estrogen.
oh, yes. And that's not estrogen dominance. Those are two different things. High circulating estrogen and estrogen dominance are not the same thing. And we talk about that in another podcast. But no, this is where because we monitor 50 clinical indicators along with blood work. So then we started to see the clinical indicator score started going up as the estrogen got out of a range. So then we would bump that estrogen down and put them in back into this range where they felt great and they can't imagine feeling any better. And so we found out what this range is. And this is why we call it the sweet spot. It is a destination that we shoot for in our clinic. But not everybody does well in that range. I have to say about 80 to 85% of women do best in this range. But to feel the effects of most women in this range, some women need a little less. Like one patient I had this morning, I was working with her, and I mean, she's really on like 25% of the dose where most women do best, but she's able to yield the same levels with just a quarter of the dose of these other women. So it is per patient, and that's how this is tailored. But though we're shooting for a particular range, we're not married to that range. And that's why we have to pay attention to the clinical indicators of the patient along with the blood work.
I've heard you call this the Goldilocks effect.
Oh, yeah, because you can't have too much. There is a just right. And I don't want women or doctors to be afraid of taking hormones or prescribing hormones or how high they can go, because there is a place. And this is what we teach at our institute when we train physicians. It's like, listen, where most women do best, we teach them how to titrate these hormones through a process that allows the patient to adapt to these hormones to the point where they can't imagine feeling any better, and how to make that decision of what that last dose is. And then actually the goal at this point is to have the patient maintain this sweet spot of hormonal success, of really a optimal hormone homeostasis. And this is the goal, to get the hormones to the hormone sweet spot and keep those hormones balanced for life. And nobody else is doing this because doctors are too afraid to take it to that level because they've always been afraid of estrogen. But since this fear of estrogen causing cancer is dissipating, I think that and we talk about this in the future of menopause medicine in that podcast, where we're going with this.
Yeah, that's been debunked, is what you're referring to. That falsely came out of the Women's Health Initiative study that was released in 2002. And the big headline out of that was estrogen causes breast cancer. And that was a massive chilling effect. The statistic is something like 65% of women who were on estrogen immediately stopped, and an entire generation of women completely missed HRT. And I just happened to be living out of the country right around that time. And so the rest of the world didn't freak out like that, at least in some areas. So I was able to go on HRT at the time when people were being pulled off of it. I wasn't even aware of the Women's Health Initiative study, but that did have the chilling effect, and started this misinformation that estrogen causes cancer, which became the big scare. And that's now been fully debunked, fully disproven. They're taking the black box warning off of estrogen, the FDA. So we've come a long way, but there's still a lag in understanding and education for a lot of physicians and of course, just individuals.
Yeah. And the most frightening part about it all, and this future is, right now there's no real there is a standardization of care of, they're calling it menopause hormone therapy now, but it really is a hormone therapy designed to manage the symptoms of menopause that are really the symptoms of estrogen deficiency, because menopause doesn't have symptoms. It's just an anniversary. The symptoms that women experience are really those symptoms of hormone deficiencies, estrogen, progesterone, and other hormones. So I think that just lifting that black box warning will now give us a look at what is this education, if any, that physicians are getting, and is it any good? But see, this is my concern, is these doctors will learn the first and second generation HRT protocols as the standard of care officially, and they won't look at these more advanced protocols designed for full restoration. And that's my concern. And that's one of the reasons I wanted to start this podcast, was to let women know that, hey, you don't have to buy into this menopause movement, that you can actually fully restore your hormones in a way that wakes up your brain and body, so it doesn't feel like it's going down the decline, or experience the symptoms that many associate with menopause and perimenopause.
Right. And to also let physicians know that, and that they can get trained in this.
Oh yeah, there's training. If you want to learn how to fully restore your patient's hormones and not listen to them complain about the symptoms that you don't know what to do about, yeah, get trained, because there are more advanced protocols. They're just these types of training, like what we offer at Panacea Sciences, they're hard to find because a lot of doctors are really afraid of, oh, but am I going to get in trouble? How high can I prescribe? Because right now there's just no standard. But like I said, I'm worried about the standard will only be up to second generation HRT, but
which is essentially a low dose
which is a
protocol.
low dose. But yeah, you have to say that even with the WHI study that scared a lot of people, you have to say, really, because of Suzanne Summers, even during this time, this information coming out, she writes a book and all these women are flocking to HRT saying, I don't care if I die from cancer because I feel so good, and then now when women have been on these hormones for all these years and didn't get breast cancer, especially, all we did and all we do in our clinic is advanced hormone therapies. So if estrogen really caused cancer, our patients would be getting cancer left and right. And this is also one of the things I documented over the years. How many patients taking HRT have gotten cancer? And the statistics are shocking. But they don't have this type of research because they don't research therapeutic dose protocols for women to see just how cancer protective estrogen is, how neuroprotective estrogen is. I mean, estrogen is designed to protect the female body from head to toe. And this is the research that we need. And this is why I get excited. I get a little heated over this, because there will be another movement that women will realize that, yes, they're getting hormone therapy. They're lifting the black box warning. More doctors are going to prescribe hormone therapy. There's a lot more of these pop-up online hormone clinics that are giving these low dose hormones. But pretty soon women will get really irritated at the fact that the doctor will say, sorry, you're maxed out on your dose. Continue to buy my supplements and products. Well, women will be like, well, can't you just women will do it themselves, like they've been doing it themselves in these groups all along, because doctors are not getting it. And pretty soon women will be like, no, I need more. And then they'll start to learn to regulate their periods with these hormones, but there really is a better way to do it. And there is a technique and a process. And I believe that that's the future.
Yeah. So you're really doing with Panacea Sciences, the protocol that you've developed and teach and also coach and provide to patients is an advanced hormone replacement therapy. And so this is therapeutic level dosing, getting women to their hormone sweet spot where they can't imagine feeling any better ever than they feel right now.
Yeah, we call it advanced protocols because this is the echelon of HRT. It is not your low dose symptoms management HRT. We're not giving women minuscule drops. We're giving them therapeutic doses at the right amount and in the right way. And so it is advanced and it is sustainable. Low dose protocols are not sustainable. It's sustainable for the physicians that are prescribing and the functional medicine practitioners that are making money selling the supplements to manage the symptoms. But our goal is to give women enough of the right hormones so they don't have symptoms of hormone deficiencies that need to be managed with drugs and supplements. So it's a different approach. And we believe it's the future because women will demand it. Because once women get enough of the right, like me, you couldn't pry my vial of estrogen out of my hands. I will never go another day without estrogen ever, ever. It's like night and day. I mean, could you imagine what the world would be like if all women were hormonally balanced and happy every day for no real good reason? I mean, I think about that.
Now that I'm aware, and it's been a journey for me as well. I have been on hormone replacement therapy since perimenopause, but I didn't realize that what I was on was a low dose therapy. And I was kind of went up and down and around because I was also living in different places. So I didn't have a consistent provider. So it wasn't until a year ago when I wandered into one of these forums on HRT, and I read that a woman who was 70, and she talked about a level of estrogen around, in the 200s or more, and her hormone sweet spot. And I thought, what is that? I know nothing about this. What is she talking about? I want that. And she hooked me up with you. And you really opened my eyes. And I feel there's no going back. Absolutely not.
And part of my job as a clinical hormone coach is to teach women what's actually going on with their body and what these hormones are responsible for, and how to read their bodies to know when they need more or if there's something going on. And as you know, it's been an educational process too. It's teaching you how to take the hormones, what to expect, how to read your body to know if there's something going on, how to read your own labs. Yeah, the more you understand what's going on and to work in a team environment, because as you know, it's the coach, the patient, and the hormone prescribing physician, because it is a team effort with advanced HRT protocols. Estrogen, it really is the most powerful tool a woman has at her disposal. And I hope that with these podcasts and working together, you and I, to create awareness that women, well, they do have a choice whether they want to experience perimenopause or menopause or not. And if you stick around and listen to us in our podcast, you'll know what we're talking about and you'll learn more. The more women understand how this works, the more control they will have over their brains and bodies for the rest of their life, consistently and sustainably.
It's exciting, Marie. This is really the future of HRT and women's health, women's mental health. I mean, this is enormous, this topic, and we're really just at the tip of the iceberg of what's possible. And unfortunately, there's still a lot of confusion out there. There's not a lot of education either for physicians or patients. But again, as you said, what we're trying to do with this podcast and all of the things that you're doing, your blog, your newsletter, is educate women as to what's possible, what's available, and give them the information so that they can be empowered. Speaking of, if people want more information, where should they go?
So if you're a woman who's suffering through perimenopause or menopause, or you're on HRT and it's not working, or you want to start taking HRT, then go to advancedhormonebalancing.com and book a consultation on that page and see if an advanced hormone balancing program is a good fit for you. Our programs are not for everybody, but I tell you something, they are life-changing if it's a good fit. So book a consultation. It's certainly not a sales pitch. It's is it a good match type of consultation.
And that's free, correct?
Oh yeah, it's a free consultation. And one thing I do want to interject about getting back to the estrogen and cancer thing is I did just write a blog post about this. So if you want to learn more about estrogen and cancer, read that blog and send me a message if you have any questions. And you can continue listening to this podcast. And if there's something you would like us to discuss on this podcast, then go to menopausemoxie.com/podcast and send us a comment, and you'll have a chance there to use a form and let us know what you think and what it is that you'd like us to cover.
Marie, thank you for sharing your professional journey with us today and your knowledge and the things that you've been learning over these past several decades. And I also thank our audience for joining us.
All right, thanks a bunch. We'll see you soon.